Hi, everyone, and welcome back to the Stress-Free MD podcast. I am really excited that you're here today because we have a special guest. My friend, Dr. Emmie Strassberg is here. And Dr. Strassberg is board certified in OBGYN and maternal fetal medicine. And for those of you who are not in healthcare, maternal fetal medicine is the study and care of complicated and high-risk pregnancies. So individuals that have other special things going on and they need specialists to help take care of them, whether it be them or their fetus during their pregnancies. Dr. Strassberg is the expert in that. She's on staff at Shenandoah Valley Maternal Fetal Medicine, which covers both Virginia and West Virginia. And she has a special interest in research pertaining to patient education, fetal growth curves, and patient and provider approaches towards vaccination during pregnancy. Her contributions have been recognized both nationally and internationally as she presented her papers in both locations. She's also a certified life coach, and that's where we met. We've coached each other, and she's wonderful. And while we were coaching and while we were chatting about different things, she learned about my RX Inner Peace program that is a CME accredited program for physicians that you've heard me chat about. And what became really important to me that she taught me was that the program wasn't only for her and her own self-care, but she was interested in the program to help her patients. And what Dr. Strassberg taught me was that stress, maternal stress, impacts not only the mother, but the fetus, the unborn child. And that was incredibly impactful, that whatever she was learning, she was going to be able to teach her patients so that they could help their unborn children. And so I warmly welcome Dr. Strassberg here. She is also the co-host of the Journal Club on the Beloved Holistic podcast. So Dr. Strassberg, welcome. Thank you so much for being here.
Thank you. Thank you for having me. Yeah, that's a nice introduction.
Well, you're pretty amazing.
Thank you.
So if you could share with our audience what you shared with me, through your lens, the lens of the maternal fetal medicine physician, what you've come to understand with respect to stress and the impact that it has not only on the mother, the woman carrying the fetus, but the fetus, and then the child after the child is born.
Yeah, well, I'm still learning a lot about it, but I went to this amazing conference at Children's National in DC, and I think it was 2019, on the effect of maternal mental health on the fetal brain development, which was fascinating, but also pretty disturbing that maternal stress and mental health, it seems, does in many cases significantly impact fetal brain development and can be associated with higher chances of developmental issues and mental health issues in their children and offspring if not well controlled. And then specifically, the one thing they went into there in detail was adverse childhood events and impact on epigenetics and fetal brain development. So that was fascinating. But the big takeaway for me was that this, maternal mental health, of course, impacts fetal development. And then the other thing they went over a little bit was mother and child bonding after delivery, especially after traumatic delivery. And it was a really eye-opening conference. But what my partner and I, who both went, came out of that with was that we really just want to figure out how to support our patients with their mental health more. And I think for me, that was one of my first steps into wanting to do coaching, because I had been doing some life coaching and I knew how much that had impacted my own path towards better mental health. And I guess I don't even want to say mental health, like mental hygiene.
Yeah.
It's not like I ever had any significant mental health problems, but certainly much better after life coaching. And And they did point out some studies in that conference on the impact of mindfulness on anxiety and pregnancy and outcomes. So that showed me that's one thing that we can do that's not a pill or medication or anything expensive that can impact patient care. So then, how do you teach patients that? And it just, for me, I don't have a lot of time, and I just individualize it. If the patient is open to exploring different ways to try to keep up mental hygiene, we do talk about different types of meditation and grounding exercises. And some of it is just that, from our coaching world, reminder that our primitive brain is there to keep us safe. So sometimes that manifests as anxiety, and it doesn't necessarily mean that anything's going wrong. And then I have started to look into trauma-informed care and things like that too, because what I'm finding is really what a lot of my patients are dealing with is trauma. And whether that is trauma as in like past abuse, or more commonly in my patients, a past pregnancy trauma, like where they had an emergency C-section and they didn't really ever process that. And they're still feeling like something went terribly wrong, even if they have a healthy child, right? Or they had a pregnancy loss, and sort of trying to come to terms and enjoy the next pregnancy with that also ever present. And so what I've been doing recently is just trying to figure out how to navigate that and be like a support for them in that, So that's been where my journey's gone so far. I had one of my classmates from coaching, and a couple other coaches did a room on pregnancy loss on Clubhouse for a while, which was really very, I guess, eye-opening and amazing for me. And we just really held a space for an hour where people could come and just discuss their pregnancy losses and how, like, what their journey with that was, which is really eye-opening for me as a physician, because I only see it from my side, right? And then to hear what, people hear when you tell them things. And I think the biggest part of pregnancy loss trauma is that nobody talks about it. Yeah. Nobody wants to talk about it with you, right? Like, everybody wants to just it to be okay, and they don't want to have the discomfort of talking about the loss, but it's really important to move past it. And one of the ways people can do that, it's not the only way, but one of the ways is to be able to talk about it with people. And a lot of the patients that I talk to, it's, I just want to be able to keep the memory of my child alive, but nobody wants to talk about it.
So your patients can come to you with stress for many different reasons, whether it's a past traumatic pregnancy, whether they've had abuse in their life, whether they're extremely anxious about what their specific reason for coming to you, like why they're high risk in the first place. That could cause a lot of stress. And so you described that the conference you went to and what you've come to learn is that this can then turn into affecting epigenetics and adverse child events. So can you share with our audience who may not even know what those two things are, what they are, and what that means?
So epigenetics is really just like trauma that's passed on genetically. And I think they've done studies with, certainly the African-American population who descended from slaves and everything that has to do with racism, and how that's internalized and shows up in epigenetics, but also Holocaust survivors, and how sometimes that trauma is also passed down through generations. Adverse childhood events, it's really you can go online and look, there's, questionnaires you can take and scores you can get, but basically exposed to violence or trauma in childhood, and higher scores can influence how, women experience pregnancy and their fetus experience development in pregnancy and beyond. What they did find actually was that they had they made a different score of positive childhood events. I don't know if that's actually called, it's like the opposite of adverse childhood events, and they do balance each other out. So children that have had good events in their childhood to balance out some of the trauma do tend to have carry less of that trauma with them. I think that was the answer to your two questions.
Yeah. Just because I know that we have healthcare professionals that are listening, but we also have individuals who are not in the healthcare field. And I want them to be able to understand what you're sharing, because it's so important. And these are two topics that decades ago, when I was going through medical school, we never learned about. The fact that we can pass down to our offspring, through our genetics, our past experiences, that they can be affected. So the importance of keeping ourselves as healthy as possible, your patients that are carrying these unborn children as healthy as possible, so that their children will be as healthy as possible, not just only physically, but emotionally, psychologically, mentally. You talked about their brain development being affected. What do we know about the brain development? Like, how is that affected?
So interestingly enough, female fetuses seem to be more flexible in these cases and more resilient, but male fetuses are the ones that tend to take on more, have more trouble basically with, social development, and even like sociopathic behaviors in some cases, if it's not treated early on.
Yeah.
And then they think it may have to do, this was like 2 days worth of talks, some of which I could get a grasp on, and some of which was like down to the biochemical level, which is, a little bit more exhausting for me to try to wrap my brain around.
I get it.
But really talking about, like, basically the fetus is bathed in hormones, and hormones change, are very active in fetal development and maturation of the brain cells and all of that. So basically some of these hormones that are higher with stress and anxiety can divert some brain development pathways, basically. And they don't know exactly how yet. They're still working on all of this. These people are brilliant. I don't know. they really are. But that, I found that fascinating to me too. And then really trying to study the sort of the two, they categorize children as either, and of course nothing's ever black and white, right? But being more like dandelions or orchids, right? So orchids really need very specific kind of tender loving care to thrive. And dandelions, you can kind of put them anywhere and they'll do just fine. And some of the studies they were doing were based on, like, well, okay, we know, females for sure seem to have a little bit more resilience, but not looking at gender. What else is defining, and that I don't think they had figured out yet. Like, some, even, despite trauma, maternal trauma and stress and anxiety, some of them still had children that were absolutely developmentally did very well no matter what. So yeah, there's certainly more research to be done.
Yeah.
I think that the biggest takeaway for me is that it seems to matter, and that,
yes,
as much as we focus on physical health and medication compliance and all these other things that we're taught to do as physicians, the mental health is something that's still pretty lacking, that we could focus on more. My biggest problem, as far as like people with significant mental health problems, which I would say was at least a quarter of my patients, there are very few psychiatrists and even psychologists and licensed social workers that provide mental health care to my patients, especially in our West Virginia area. There's actually the community health center is really good, and they have mental health providers there, and those patients are, from what I can see, very well taken care of. But for the West Virginia patients that aren't in that clinic, I had one patient basically tell me, like, I called them and they said, I either have to be on drugs or suicidal, and otherwise it's a 6-month wait. And so this pretty much falls to us in the OB world, either the primary OBs or maternal fetal medicine, to take care of maternal mental health, because there's just not a lot of other resources out there. And so I do talk about it with my patients, even though sometimes, all I can do is listen, but sometimes that's a lot.
Listening and empowering your patients, teaching them tools that they can use to help themselves while they're waiting for these mental health care appointments or in between is incredibly important, right? So there's both passive helping, right? Passive serving, where they're seeing these mental health care professionals, or you have an ear, or there's active learning where you're actually teaching them, sharing with them tools that they can do to help themselves. Yeah, to decrease their stress, to decrease their anxiety, to help their mental health, which does directly impact their body, right? It impacts them physically and then impacts their unborn fetus. So I've had the pleasure of having you in my program, and I would love for you to share the tools that you found helpful for yourself that you've been sharing with your patients.
Yeah. So for sure, the meditation, I think, is probably the biggest one. I think even in our OBGYN, our obstetrics and gynecology journal, a couple months ago, there was an article that showed that they actually did a randomized controlled trial with OBGYN patients, both pregnant and non-pregnant, using the Calm app. And even 10 minutes a week of using that app, the quality of life and sleep and improvement scores that the patients then reported on follow-up were significantly improved, which I think is fascinating. Like, even just a little bit of this kind of, mindfulness meditation significantly improves people's lives. So I actually am not a huge fan of the Calm app myself. I like Headspace and Insight Timer, like I told you. But I don't have anything against Calm app. It's just, I think I just started using the other ones first. But it is something very accessible to my patients. And, I tell them there are many apps out there that can try them, or YouTube has some great meditation, but you can find a lot of Deepak Chopra stuff on YouTube. So people do try that. There's one I tried a little bit in pregnancy called Expectful. It's like pregnancy specific meditations. I didn't find it. I didn't find the need to use it over Headspace, because I really like Headspace personally. But it's just, I tried it out just so that I could tell my patients, like, well, if you want something specific to pregnancy, there's this, and there's a free version that's at no cost. So, but meditation for sure is helpful. Sleep is a huge one. I think I told you, since using the iRest and Yoga Nidra sleep meditations, that has like drastically improved my quality of sleep. But I also go over them with them, of course, like sleep hygiene, right? Like not being on tablets before bed and not watching TV as you fall asleep. And, some people are just not ready to make those life changes, but even, hearing it a few times, sometimes people do. So I think those are the biggest takeaways. I love the somatic yoga, but I'm not at a level to be able to teach that to people right now. Actually, I have a great friend locally who used to do prenatal yoga, so I would send a lot of my patients to her class. But and I took it myself when I was pregnant, but she doesn't do that right now with COVID. So it would be great to offer that again. I've been talking with her about trying to combine that with the pregnancy life coaching and see if we can come up with something together.
You can do anything. So important takeaways here are that you can do things to help yourself, that meditation has been really helpful, not only to you, but to your patients. And studies have shown that you can do it in as little as 10 minutes a week. I mean, everyone's got 10 minutes in a week. Of course, I would like you to do 10 minutes a day, but at least, but I mean, the studies have shown that a little bit makes a difference, and that there are lots of different flavors, right? So if you don't like one, there are others out there. There are lots of different, just like there's lots of flavors of ice cream, there are lots of flavors of meditation. You know that I'm a big proponent of iRest. I mean, that's what I'm certified to teach. That's what you've learned. And that's just one flavor, but there are many flavors and lots of apps that you mentioned. And so being able to find something that works for you and
The
recognize.
iris, I have to say, like when I take the time to do the longer meditations,
Yeah.
it's just amazing. And then I'm always like, why don't I do this more often? I
Yes,
just have to
it
carve
is.
out the time in my day to do it. Because I mean, the 10, 15 minute ones are pretty good, but the ones that go like almost 45 minutes, like I always come out of that feeling really good. So
yeah, it really helps to process whatever experiences are going on and to really like pressing the reset button. But I'd like to encourage anyone listening that whatever you do, even if it's for a few minutes, is more than what you were doing before. So that whatever you do is enough. And, I get that a lot. I don't have time. So even if it's 5 minutes, it's 5 minutes that you weren't giving yourself before, and it will make a difference. So recognizing that there are things you can do for yourself. We talked about meditation, lots of choices, lots of free things you can do as well, and lots of different voices and flavors. Sleep, you mentioned sleep hygiene. I love that term. Mental hygiene, sleep hygiene. Yeah, it's just,
it's like brushing your
care of
teeth.
yourself.
Yeah.
Like brushing your
Very
teeth.
important.
Right. Like brushing your teeth. People talk about, the importance of sleep a lot, and the sleep cheat, right? Not cheating yourself, because sleep is medicine, and giving your patients ways that they can improve their sleep, super important.
Yeah. And then journaling, I do recommend to patients too. I don't really go into the specifics of like, in coaching, we talk about thought downloads and models and things like that.
Right.
Just really just emptying out your brain and seeing what's there. I often just write it on a throwaway piece of paper and then recycle it. I don't almost never save my journaling anymore, but that definitely helps too, especially when your brain's like just circling and circling.
Yeah. So writing down your thoughts. So a thought download, for those of you who don't know, is basically emptying out your brain, or a brain dump, writing all of your thoughts down on a piece of paper, and they're just looking at them, really just looking at them. And we could do a whole
Picking out
other
the
thing.
junk from the things that we want to keep thinking. Yeah.
That's right. Like throw away the junk, see what's really not true, focus on what is. Yeah.
It's like emptying out your closet.
Exactly. Just keeping the stuff that you really love. Absolutely. Okay. So Dr. Strassberg, what if you could just, leave our listeners with one important takeaway, what would you do? What would you say to them?
Yeah. The other thing that I tell my patients, which I think is really true, and I'm incorporating this into my pregnancy coaching program, is pregnancy is the best time to not only get to know your body, but learn how to take really, really good care of it. Because if you can get this habit down in pregnancy, and especially through postpartum, for sure through postpartum, then you're like good for life. If you can figure out habits through pregnancy and postpartum, chances are you'll be able to stick with them. And it makes it so much more, I don't want to say tolerable, because that's not the right word, but just so much more livable. It just makes it better.
Thank you. And better for the mom, better for
mom, better
for the baby. Yeah. And future babies. Yes.
Yeah.
So we have, again, healthcare professionals that may be wanting to reach out to you to learn more. We have, potential patients that may want to reach out to you to learn more about what you do, and to maybe, consult with you. So what is the best way for them to reach you?
I have a website for my coaching. It's just my initials and life coach. So ERS lifecoach.com. That's what I came up with.
Okay.
And
so
my email, you can message me through there. You can look at my, if you wanted to do a 30-minute meeting to talk about coaching with me, you can schedule it through there. So I would be happy to talk to anybody, whether they want coaching or they just want to talk. That's fine.
Okay, so they can reach you through the coaching website, and then the website for Shenandoah Valley Maternal Fetal Medicine, would they be able to reach you through there in terms of being a patient of yours?
Yeah, it's so interesting with maternal fetal. We do take self referrals if you're local. but we pretty much see everybody in the area because there's not very many other MFMs in our area. But yeah, you can certainly look there. Yeah.
Okay.
Shenandoah. I mean, if you Google Shenandoah Valley Maternal Fetal Medicine, you'll find us. Yeah.
Okay. And co-hosting the Journal Club on the Beloved Holistic podcast. So anyone
Yeah, I do that with Nathan Riley. So yeah.
Okay. Okay. Well, thank you so much for joining us. Thank you, Dr. Strassberg. I'm so grateful that you gave us your time and your insight and all those pearls. Thank you to all of you listening for taking time to take care of amazing you. Remember to be kind to one another and to be kind to yourself. And I look forward to connecting with you on the next episode of the Stress Free MD podcast.